Probably noticed there's been a lot of conversation about this. We're wearing red. Maybe you have a shade of red lipstick or something, because today we are going red for heart health. Heart disease is the #1 cause of death among women.
All right, try this at home. If you clasp your hands together, this is about how big your heart is. Not that big, right? But it is critical to our well-being. Broward Health cardiologist Dr. Yordanka Reyna is helping us separate fact from fiction. So I talked to her and I asked, first up, your heart health connected to your brain health, fact or fiction?
That is a fact. So I think the heart health and mental health they're both very important, and we need to take care of them both at the same time.
So Alzheimer's disease and dementia, of course, often have the same risk factors that cause heart disease, like high blood pressure, diabetes, obesity as well.
That's right. Okay, next up, if I'm young, I don't have to worry about heart disease.
That is a myth. That's not true. You know, you have 4 to 10% of young adults less than 45 years of age who do develop heart disease. So it's very important to know your family history, to know what your parents suffer from and grandparents.
Take a dive into your family tree, right? Find out what's there, because knowing your history, that can be proactive.
All right. Well, not being physically active puts you at higher risk for heart risk, we're talking about here, than smoking. Fact or fiction?
I would say that is a myth, because they're both as important. So being physically active is very important to prevent heart disease, and being a smoker is also very at high risk for having heart disease because of the nicotine that builds up in the coronary.
Stay active, don't smoke. I'm going to give you 7 simple steps from the American Heart Association. Life's simple 7. They're right here. Manage your blood pressure, control cholesterol, reduce blood sugar, get active, eat better, lose weight, and stop smoking.
So when we say know your numbers, this is what we're talking about, having a conversation with your doctors. Now, we're talking about a lot of numbers. You just heard from a doctor there. But what about hearing from a heart failure survivor? That's ahead. Listen.